Welcome to the podcast series The New Student Pharmacist, where we discuss chemistry and pharmacy, as well as leaders in pharmacy careers, community, and chemistry and pharmacy research. We encourage you to support the work we are doing and follow us on Spotify and Apple Podcasts by subscribing for free. Note, the views on the podcast represent those of my guest and I.
Okay, good afternoon. It is so good, it is so thrilling, it is so exciting. Today we're going to switch things up a bit. We're going to be having a vis-a-vis, tete-a-tete conversation on pharmaceutical chemistry. I won't be referencing the notes of some of my professors. However, I won't be showing the notes. I'll be referencing the notes. It'll just be an audio discussion with the notes being referenced. So the first topic for today will be serotonergic and antidepressant agents. A reference to the notes of specifically Dr. A. Kulkarni. So let's just go through them. Some introductory ideas: the biosynthesis and metabolism of serotonin, receptor types and subtypes, as well as we're going to be looking at targeting and serotonergic signaling, and then we'll conclude for that topic. But this is going to be a long episode, very, very long episode, because we're going to go through serotonergic and antidepressant, opioid agents, cholinergic agents, as well as some fundamental ideas associated with pharmaceutical chemistry. So let's begin. Okay, so serotonin. Serotonin, otherwise known as 5-hydroxytryptamine, or 5-HT, was identified as a neuroreceptor ligand in the late 1940s. Serotonin is associated with depression/anxiety, schizophrenia, hallucinations, drug abuse, appetite control, vomiting, etc. Just a quick note, these episodes are not intended for medical advice, counseling, or suggestions. please refer and consult the relevant medical professionals, whether it be your physician, your GP, your general practitioner, your physician, your NP, your nurse practitioner, your physician assistant, as well as your pharmacist. Make sure they are licensed in the state and registered with the board as well. So, continuing on, advances in histochemical fluorescence techniques led to the application of radioligand binding assays for 5-HT and elucidated the pathophysiological role in a variety of aforementioned disorders, so depression, schizophrenia, obesity, etc. It is also established that types and subtypes also referred to as families and subfamilies. So the types and subtypes are also referred to as families and subfamilies of the serotonergic receptors, similar to opioid receptors. Okay, so now I'm not going to show any structures in this. This is going to be a tete-a-tete, a face-to-face conversation about these concepts. So, serotonin biosynthesis and metabolism. Hydroxylation at the 5 position by tryptophan hydroxylase, present in the serotonergic neurons. So let's just delve into what's happening with this serotonin biosynthesis pathway. Let's delve in a bit. Let's see. So if we look closely at the pathway, tryptophan goes through tryptophan hydroxylase. So tryptophan, which has a characteristic indole functionality. So it has a characteristic indole functionality, so an aromatic functionality, and the classic amino acid backbone structure with your carboxylic acid, your alpha carbon, with the substituted amino acid through, or is processed by aromatic amino acid decarboxylase to form summation of 5-hydroxytryptophan. So moving right along, serotonin release, uptake, and signaling. Biosynthesis takes place in serotonergic neurons. Biosynthesis, release, and reuptake mechanisms similar to other receptors. Is similar to the biosynthesis, release, and reuptake mechanisms are similar to what occurs in other neuroreceptors. The serotonin is stored in presynaptic neuronal vesicles. When released, serotonin interacts with the postsynaptic serotonergic receptors. So the action of 5-hydroxytryptophan is terminated either by its diffusion away from the synapse with subsequent metabolism or reuptake mechanism back to the presynaptic neuron. So serotonin transporter, also known as 5-HTT, is a sodium-dependent monoamine transporter protein. So when we talk about some of these neurotransmitters, we recognize that they are monoamine. And that's the case with many of the catecholamines. So catechol, the catechol group, catechol structure, and catecholamine. So like dopamine, norepinephrine, serotonin, those types of things. So moving right along, monoamine transporter protein, and is also a druggable target for the development of antidepressants. So that's an important point to take note of. Serotonin transporter, also known as 5-HTT, is a sodium-dependent monoamine transporter protein and is a druggable target for the development of antidepressants. So 7 types of 5-hydroxytryptophan. There are 7 types of 5-hydroxytryptophan receptors, denoted by 5-HT1 to 5-HT7. All except 5-HT3 are coupled to G proteins. 5-HT3 is a ligand-gated ion channel selective for sodium cations and potassium cations. Okay, so serotonin receptor types. So you have the 5-HT1 family. So further subdivided into 6 subfamilies: 5-HT1A to 5-HT1F. So 5-HT1A to 5-HT1F. Subfamilies are present in the CNS. So 5-HT1A through E, also found in blood vessels, is involved in functions such as anxiety, addiction, vasoconstriction, etc. With the exception of 5-HT1E, all other receptors of this family exhibit high affinity for 5-carboxamidotryptophan. So with the exception of 5-HT1E, all of the receptors of this family exhibit high affinity for 5-carboxamidotryptophan. So also 8-hydroxy-2-di-N-propylaminotetralenine, or OHO, or 8-OH-DPAT, represents a selective 5-HT1A agonist. Very important. 8-hydroxy-2-di-N-propylaminotetralenine, or 8-OH-DPAT, represents a selective 5-HT1A agonist. This suggests that an intact indole nucleus is not required for 5-HT1A agonism. Let's keep going. Okay, so 5-HT1A selective agonists. We're looking specifically at long-chain aryl piperazines. So long-chain aryl piperazines, or piperazines. So long-chain aryl piperazines, LCAPs. LCAPs possessing long-chain substituents at the N4 piperazine show good selectivity for 5-HT1A. So long-chain aryl piperazines possessing long-chain substituents at N4 piperazine show good selectivity for 5-HT1A. Buspirone was the first agent from this class approved as an anxiolytic drug. Structurally related compounds, gepirone, tandosperone, and ipsapirone, these agents act either as a full or partial agonist of 5-HT1A. So remember, an agonist has 100% efficacy, partial agonist has about 0 to 100, falls in that range of 0 to 100 efficacy or intrinsic activity. And we're talking in respect to the endogenous ligand for the receptor. And those concepts have been discussed in the previous episode. So agonism, antagonism, partial agonism, inverse agonism, all those other good stuff. So continuing on, general structure, you typically have the aryl group, piperazine group, your spacer, so your methylene spacer, and then you have the terminus. Agents containing phenyl, substituted phenyl, heteroaryl, all of those groups show good activity. So agents containing phenyl, a substituted phenyl, heteroaryl, all of those groups all show good activity. Changes in the piperazine structure are not tolerated. Important to note. Changes in the piperazine structure are not tolerated. So placement of the amide or the imide groups at the terminus is essential for good activity. One more time. Placement of the amide or the imide groups at the terminus is essential for good activity. All of the drugs shown above have an imide, I-M-I-D-E, imide, moiety in the terminus. Very important to note. Very, very important. Okay, so 5-HT1A selective antagonists. So remember, antagonist just blocks the function of the agonist. Some compounds belonging to this class display structural features similar to classical agonists, buspirone. So some compounds belonging to this class display structural features similar to classical agonists, buspirone. However, the aryl portion is usually comprised of 2-methoxyphenyl moiety. So the aryl portion is usually comprised of a 2-methoxyphenyl moiety. Agents such as WAY 100-135 or WAY 100-635 are referred to as a silent 5-HT1A antagonist since they lack any agonist activity. So spirone is a 5-HT1A antagonist, but also displays high antagonist affinity for 5-HT2A and D2 receptors. So spirperone is used for the treatment of schizophrenia. So when we talk about we're talking about those spirocyclic functionalities. Okay, so let's keep going. Clinical significance of 5-HT1A agonists and antagonists. Drug development efforts explore the 5-HT1A agonists as therapeutic targets for depression and anxiety. There seems to be good correlation between 5-HT metabolism and higher tendency towards depression, aggression, etc. So drug development explores, so we're talking about the clinical significance of 5-HT1A agonists and antagonists. So drug development efforts explored 5-HT1A agonists as therapeutic targets for depression and anxiety. There seems to be a good correlation between 5-HT metabolism and higher tendency towards depression, aggression, etc. Gepirone produced significant symptomatic relief in patients with depression. Buspirone was effective in the treatment of mixed anxious/depressive patients. Mixed-anxious-depressive patients. So lack of 5-HT1A antagonists, lack of selectivity in or with 5-HT1A antagonists. So the activity at other 5-HT receptor subtypes, dopaminergic receptors, etc., has limited the drug development efforts that specifically target receptors. That specifically target that receptor. Compounds like LY426965 are more metabolically stable and also display improved oral bioavailability as compared to WAY compounds. So LY426965 is being developed as a smoking cessation drug. So let's keep going. 5-HT1D receptor selective ligands. So sumatriptan, Imitrex, was identified as the first 5-HT10 selective agonist with only modest selectivity, 2 to 20-fold, for its affinity toward 5-HT receptors, particularly 5-HT1A and 5-HT1F. Sumatriptan belongs to the indole alkylamine class of compounds. Example, somatriptan, Zomig, naratriptan, Emerge, misotriptan, Maxalt. These agents bind and display high affinity and improved selectivity for 5-HT1D. Agents like somatriptan, misotriptan possess superior ability to cross the blood-brain barrier and are used for the treatment of migraine, cluster headaches, etc. Okay, so 5-HT2 receptor family. In general, 5-HT2 family of receptors are found in the CNS, blood vessels, GI tract, peripheral nervous system, and in smooth muscles. This receptor family is considered as a therapeutic target for the development of antipsychotics, anxiolytics, anoretics, so appetite suppressant agents. The subfamilies 5-HT2A, 5-HT2B, and 5-HT2C. There is significant amino acid sequence homology between 5-HT2A and 5-HT2C, greater than 78%. This explains the overlap in ligand affinities for these two receptor subfamilies. Classic hallucinogenic drugs like lysergic acid diethylamide act as full or partial agonists for this receptor. So partial or full agonism for this receptor occurs with drugs, classic hallucinogenic drugs like lysergic acid diethylamide. The lack of type and subtype selectivity coupled with strong hallucinogenic potential has limited the use of 5-HT2A agonists. Okay, So 5-HT2A receptor antagonists. N-alkylpyridines constitute a major class of selective 5-HT2A antagonists. Best known examples are ketanserin, ritanserin, etc. These agents belonging to this class in general exhibit greater receptor selectivity for 5-HT2A/2C. So ketanserin is used for its antihypertensive properties. Ritanserin was investigated for the treatment of schizophrenia. So atypical antipsychotics such as risperidone, used for schizophrenia and bipolar disorder treatment, clozapine, used for schizophrenia and anti-suicidal drug, and olanzapine, schizophrenia and bipolar treatment, also exhibit 5-HT2A antagonist properties. Unlike typical antipsychotics, these newer compounds have a lower tendency to exhibit extrapyramidal side effects such as tardive dyskinesia, so stiff, uncontrolled body movements. Tricyclic antidepressants also are antagonists for 5-HT2A. So let's keep going. 5-HT2B and 5-HT2C receptor subfamilies. 5-HT2B receptors are present in the CNS and cardiovascular system. They are known to cause pulmonary vasoconstriction. Many ligands that bind to 5-HT2B receptor also bind to 5-HT receptors, and there is no approved drug that specifically targets 5-HT2B signaling. 5-HT2C receptors. So at the point of this reading, there was none that was seen by myself or the person who wrote these set of notes. The 5-HT2C receptors play a role in regulation of mood, anxiety, and feeding, etc. So lorcaserin, the 5-HT2C selective agonist, has been approved as a weight loss drug. And common side effects include headache. Side effects like depression, anxiety, suicidal thoughts, also uncommon, have been reported for, although uncommon, have been reported for lorcaserin. Okay, it's 5-HT3 receptor family. So here we have the ligand-gated ion channel selected for sodium cations and potassium cations and not GPCRs. Its structure is comprised of 5 subunits around a central ion conducting pore permeable to sodium, potassium, and calcium ions. By homology, it is closely related to nicotinic acetylcholine receptor. So homology, common ancestor. So agonist activation leads to the activation of the nausea and vomiting center in the brain stem. When activated, these receptors are also reported to cause seizures. 5-HT3 antagonists have also been used as antiemetic agents. These agents not only improve the quality of life, they also allow for the increasing dosing. They also allow for increasing the dose intensity of many chemotherapeutic agents, increasing the response rates for anti-cancer treatments. Patients taking paclitaxel, cyclophosphamide, and 5-FU, the 5-fluorouracil, and other emesis-prone drugs are often predosed with antiemetic agents. So, 5-HT3 receptor antagonists. Bimestron was identified as one of the first 5-HT3 selective antagonists. Many agents belonging to this class contain tropane or a tropane-like nucleus bearing a basic amine. Tropisitron, so an antiemetic, and recalcitrant, anxiolytic, zatositron, anti-nausea compound with anxiolytic properties, are examples of tropane-containing 5-HT3 antagonists. Ondansetron and renzapride, both antiemetic compounds during cancer chemotherapy, gastroenteritis, etc. Palonositron, chemotherapy-induced nausea and vomiting, are examples of non-tropane-containing 5-HT3 antagonists. Regardless of the presence or absence of the tropane ring, all of these compounds possess at least one set of protonation. Benzapride is also a full 5-HT4 agonist and 5-HT2B antagonist. Okay, so 5-HT4 receptor. It belongs to the GPCR superfamily. It is coupled with GS agonist it belongs to the GPCR superfamily. It is coupled with GS agonists. Activation results in increased intracellular cyclic AMP, so cyclic adenosine monophosphate levels, primarily located in the CNS, gastrointestinal tract, urinary bladder, heart, etc. 5-HT4 agonists include cisapride, mosapride, brucalopride, and renzapride. Okay, 5-HT4 receptor. Cisapride increases the motility of the upper GI tract and is used to enhance gastric emptying. Serious side effects include drug-induced arrhythmia. Mosapride promotes gastric emptying and is used for the treatment of gastroesophageal reflux disease, GERD, irritable bowel syndrome, etc. Brucalopride is used for the colonic mobility. Brucalopride is used for the colonic mobility. It does not induce arrhythmias. Zacopride, renzapride, and mosapride are also 5-HT3 antagonists. Zacopride displays anxiolytic properties at the therapeutic dose. Structurally, all of these compounds contain a primary arylamine as part of an aniline or dihydrobenzofuran ring. So 5-HT4 receptor agonists and antagonists. So 5-HT4 receptor agonists. Tegoserod was introduced as a 5-HT4 agonist for the treatment of irritable bowel syndrome, but was later withdrawn after reports of increased heart attack and stroke. It is also a 5-HT2B receptor antagonist. 5-HT4 receptor antagonist. Piboserod was developed for the treatment of atrial fibrillation, AFib. The drug was also developed as a potential therapy for heart failure. 5-HT5 through 7 receptors. 5-HT5 receptors are predominantly found in the brain and are further subdivided into 5-HT5A and 5-HT5B receptor subfamilies. So 5-carboxamidotryptophan is a non-selective agonist for this receptor. One more time. 5-carboxamidotryptophan is a non-selective agonist for this receptor. 5-HT6 receptor is present in the CNS and plays a role in motor control, emotional stability, cognition, and memory. The 5-HT6 antagonists have been shown to reduce appetite and promote weight loss. 5-HT7 receptor is found in the central nervous system and in the cardiovascular system. It is involved in thermoregulation, circadian rhythm, learning, and memory. It is also investigated as a target for depression. So, serotonin reuptake transporter. Serotonin transporter, SERT or 5-HTT, is a monoamine transporter protein that transports serotonin from the synaptic cleft to the presynaptic neuron. It belongs to the monoamine transporter protein family. SERT regulates the duration and magnitude of the postsynaptic response to 5-HT. It allows the body to reuse serotonin and prevents the need for constant biosynthesis. SERT comprises of 12 transmembrane helices. Both amine and carboxy termini are present intracellularly. It exhibits 50% homology with norepinephrine reuptake transporter and dopamine transporter, etc. So serotonin reuptake transporter. Serotonin reuptake transporter is an attractive target for drug development. Agents that block serotonin reuptake transporter increase the synaptic residence of 5-HT and are used for the treatment of a variety of disorders such as depression, obsessive compulsive disorders, panic disorders, and anxiety. Tricyclic antidepressants such as amitriptyline serve as non-selective blockers for SERT and NET. They're active metabolites may also block SERT and NET with varying degrees of selectivity. Selective serotonin reuptake inhibitors are much more selective for SERT over NET and lack most of the activity at other receptors, as seen in tricyclic antidepressants. Examples of this class include fluoxetine, paroxetine, fluvoxamine, sertraline, escitalopram, trazodone, etc. Agents such as vilazodone act directly on 5-HT receptors, so 5-HT1A agonists, and are selective serotonin reuptake inhibitors. Paroxetine, Paxil, is used as an antidepressant for the treatment of major depressive disorder, social anxiety disorder, panic disorder, post-traumatic stress disorder, etc. Common side effects include drowsiness, dry mouth, trouble sleeping, asthenia, so general weakness, sexual dysfunction, loss of libido, erectile dysfunction, etc. In general, these class of compounds possess at least 2-hour rings and sites of protonation. In general, these classes possess at least 2-hour rings. Chemically, paroxetine is a secondary amine containing compound, and it contains 4 rings. Okay, fluoxetine, so Prozac, is used for similar conditions as paroxetine. In addition, it is also used to treat binge eating disorder. Common side effects are similar to paroxetine. In addition, this drug is reported to cause discontinuation syndrome. Rapid discontinuation of therapy causes dizziness, disturbances in balance, tingling, numbness, electrical shock-like sensations, etc. Fluoxetine and other SSRIs, when taken with MAO, may cause serotonin syndrome. Symptoms include fever, agitation, diarrhea, seizures, muscle weakness, etc. Thus, these drugs are contraindicated in patients taking MAO inhibitors. So when taking, fluoxetine and other selective serotonin reuptake inhibitors when taken with MAO inhibitors may cause serotonin syndrome. These symptoms include fever, agitation, diarrhea, seizures, muscle weakness, etc. Thus, these drugs are contraindicated in patients taking MAO inhibitors. Fluoxetine is a CYP2D6 inhibitor and in some cases is contraindicated in dextromethorphan containing cold and cough medications. It blocks dextromethorphan metabolism. So, selective, not selective. Serotonin reuptake transporter. So, serotonin, we're focusing on the serotonin reuptake transporters. Trazodone is indicated as an antidepressant for the treatment of major depressive disorder, anxiety disorders, and also to treat alcohol dependence. Unlike paroxetine, the drug does not display anticholinergic side effects. Instead, it is reported to cause fainting, increase in suicidal thoughts, cause arrhythmias, etc. Overdose may lead to serotonin syndrome discussed previously. Okay, vilazodone is both a selective serotonin reuptake inhibitor and a 5-HT1A agonist. It does not display strong affinity for other serotonin receptors and is selective for serotonin reuptake transporters versus norepinephrine transporters or dopamine transporters. Nausea, diarrhea, vomiting, dry mouth are common symptoms. Paresthesia, so tingling, pricking, numbness, etc. are also reported. When overdosed, the drug is known to cause serotonin syndrome. Okay, so that's the end of the serotonin segment.
Welcome to the podcast series The New Student Pharmacist, where we discuss chemistry and pharmacy, as well as leaders in pharmacy careers, community, and chemistry and pharmacy research. We encourage you to support the work we are doing and follow us on Spotify and Apple Podcasts by subscribing for free. Note, The views on the podcast represent those of my guest and I.
Title: Pharmacology Lecture, Understanding Adrenergic Agents, Anti-Seizure Agents, Sedative Hypnotics, and Anxiolytic Agents. Lecture 1, Adrenergic Agents and Anti-Seizure Agents. Adrenergic agents. Adrenergic agents are a class of drugs that mimic the effects of adrenaline, epinephrine, and noradrenaline, norepinephrine, two naturally occurring hormones that play a role in the body's fight or flight response. Adrenergic agents are used to treat a variety of conditions, including asthma, heart failure, and high blood pressure. There are two main types of adrenergic agents, agonists and antagonists. Agonists activate adrenergic receptors, while antagonists block them. Adrenergic receptors are classified into two main types, alpha and beta. Alpha receptors are responsible for constricting blood vessels and dilating pupils, while beta receptors are responsible for increasing heart rate and blood pressure. Structure-activity relationships of adrenergic agonists. The structure-activity relationships of adrenergic agonists are complex and not fully understood. However, it is known that certain structural features of a drug molecule are important for its ability to bind to an adrenergic receptor and activate it. These features include the presence of an aromatic ring, a hydroxyl group, and an amine group. Clonidine is an example of an adrenergic agonist that is used to treat high blood pressure. It has a relatively simple structure that consists of an aromatic ring, a hydroxyl group, and an amine group. Key anti-seizure agents. Anti-seizure agents, also known as anticonvulsants, are a class of drugs that are used to treat seizures. Seizures are sudden bursts of electrical activity in the brain that can cause a variety of symptoms, including loss of consciousness, muscle contractions, and sensory disturbances. There are many different types of anti-seizure agents, and the best one for a particular patient will depend on the type of seizures they have, their medical history, and other factors. Some of the most common types of anti-seizure agents include phenobarbital, carbamazepine, valproic acid, lamorigine, levetiracetam. Pathophysiology of seizures and strategies in treatment. Seizures are caused by a sudden and excessive discharge of electrical activity in the brain. This discharge can be caused by a variety of factors, including injury to the brain, infection, strokes, tumors, genetic disorders. The best treatment for seizures will depend on the underlying cause. In some cases, seizures can be treated with medication alone. In other cases, surgery may be necessary. Mechanism of action of hydantoins and fosphenytoin. Hydantoins and fosphenytoin are two types of anti-seizure agents that work by blocking sodium channels in the brain. Sodium channels are responsible for transmitting electrical signals between neurons. By blocking sodium channels, hydantoins and fosphenytoin can help to prevent seizures. Fosphenytoin is a prodrug of phenytoin, which is a hydantoin. This means that fosphenytoin is converted to phenytoin in the body. Fosphenytoin is available as an injection, while phenytoin is available as a tablet or capsule. Mechanism of action and indication of topiramate. Topiramate is an anti-seizure agent that works by blocking a variety of ion channels in the brain. These ion channels are responsible for transmitting electrical signals between neurons. By blocking ion channels, topiramate can help to prevent seizures. Topiramate is also used to treat migraines. Sedative hypnotics. Sedative hypnotics are a class of drugs that are used to induce sleep or reduce anxiety. They work by depressing the central nervous system, CNS. There are many different types of sedative hypnotics, and the best one for a particular patient will depend on their individual needs. Some of the most common types of sedative hypnotics include benzodiazepines, for example, diazepam, lorazepam, barbiturates, for example, phenobarbital, non-benzodiazepine hypnotics, For example, zolpidem, esopiclone. Sedative hypnotics should be used with caution, as they can be addictive and can cause side effects such as drowsiness, dizziness, and impaired coordination. Introduction. Adrenergic agents. 1. What are adrenergic agents? Adrenergic agents are drugs that interact with the adrenergic receptors, which respond to the neurotransmitter adrenaline, epinephrine, and norepinephrine. These receptors are classified into alpha and beta receptors, each with subtypes. Adrenergic agonists. Key structure-activity relationships. 2. Key structure-activity relationships of adrenergic agonists, for example, clonidine, an alpha-2 adrenergic agonist, demonstrates activity by interacting with specific receptors. Key features include lipophilicity, substituents on the aromatic ring, and structural elements affecting selectivity for certain adrenergic receptors. Log P versus log D3. Difference between log P and log D in their definition. Log P represents the partition coefficient in a lipid water system. Log D accounts for ionization and represents the partition coefficient in a buffer water system, considering pH. Pharmacodynamics of salmeterol, formoterol, and alfuzosin. 4. Pharmacodynamic mechanism of action: salmeterol, formoterol, alfuzosin, salmeterol and formoterol, long-acting beta agonists used in bronchodilators. Alfuzosin, alpha-1 adrenergic antagonist primarily used for benign prostatic hyperplasia. Anti-seizure agents and seizure pathophysiology. 5. Key anti-seizure agents and seizure pathophysiology. Agents include phenytoin, fosphenytoin, and topiramate. Seizures result from abnormal neuronal activity. Treatment involves stabilizing neuronal membranes. 6. Mechanism of action and indications. Hydantoins and fosphenytoin. Hydantoins stabilize neuronal membranes by limiting repetitive firing. Fosphenytoin is a water-soluble prodrug of phenytoin with similar mechanisms. 7. Mechanism of action and indication. Topiramate. Topiramate enhances GABAergic activity and inhibits excitatory neurotransmitters. Indicated for various seizure types and migraine prophylaxis. Sedative hypnotics, alcohols, ethclovinol, and barbiturates. 9. What are sedative hypnotics? These drugs induce sedation and sleep. 10. Structure-activity relationships of alcohols and ethclovinol. Alcohol's sedative effects correlate with lipid solubility. Ethclovinol's structure influences its sedative hypnotic properties. 11. Structure-activity relationships of barbiturates. Barbiturates' sedative effects relate to the length of the side chain and substituents on the heterocyclic ring. 12. Mechanism of action of flurazepam. Flurazepam, a benzodiazepine, enhances GABAergic neurotransmission, serving as a long-term sedative hypnotic. 13. Mechanism of action of valerian. Valerian's mechanism involves GABAergic modulation, contributing to its sedative and anxiolytic effects. Antipsychotic and anxiolytic agents. 14. Antipsychotic and anxiolytic agents. Antipsychotics treat psychosis, while anxiolytics alleviate anxiety. 15. Mechanism of action and difference. Typical versus atypical antipsychotics. Typical antipsychotics block dopamine receptors, causing extrapyramidal side effects. Atypical antipsychotics modulate serotonin and dopamine, minimizing extrapyramidal effects. 16. Structure-activity relationships. Phenothiazine and thioxanthins. Phenothiazines and thioxanthins share a common core structure, influencing their pharmacological properties. General anesthetics. 17. What are general anesthetics? General anesthetics induce reversible loss of consciousness and sensation. 18 Desired properties of general anesthetics. Desired properties include rapid onset, controllability, amnesia, and reversibility. 19 Mechanism of action. Propofol, a prodrug, metabolizes into propofol, enhancing GABAergic activity. 20 Structure-activity relationships and stages of anesthesia. Lipid solubility and potency influence general anesthetic properties. Anesthesia progresses through stages: induction, maintenance, and emergence. Local anesthetics. 21. What are local anesthetics? Local anesthetics block nerve conduction in a specific area, providing analgesia. 22 Ideal properties for local anesthetics. Desired properties include potency, duration, reversibility, and minimal toxicity. Conclusion. Comprehensive understanding of pharmacological agents. This lecture has provided a comprehensive overview of adrenergic agents, anti-seizure agents, sedative hypnotics, anxiolytic agents, and anesthetics, exploring their mechanisms of action, structure-activity relationships, and therapeutic applications. Understanding these pharmacological principles is crucial for safe and effective drug use in clinical practice. Adrenergic drugs in halls of wisdom, where molecules dance. Pharmacist scholar, in quest of a trance, delves deep into realms of adrenergic lore. Dr. Wang, the guide, as knowledge does pour. Dopamine, a marvel, not just in name, a cardiovascular player in life's grand game. Receptor dance, vessels dilate and flow, in shock, me, trauma, and CHF's shadow. Dobutamine, lacking in hydroxyl's embrace, a selective B1 agonist, in cardiac space. Enantiomer dances with grace, cardiac stimulant post-surgery's embrace. Ephedrine, pseudopedrine, a duo's might, cardiac stimulant, bronchodilator's light, crossing BBB with less polar might, nasal decongestant, relieving the night. Phenylpropanolamine, appetite's foe, banned by FDA, for risks we know. N-desmethyl analog, a nasal flow, decongestant's aid, but with caution, we go. Amphetamine, methamphetamine, the CNS's thrill, crossing the BBB, a potent skill, ADHD's ally, in a sulfate-filled hill. Isomers might, the stimulant's fill. Alpha antagonists, vasodilation's hymn, tolazoline, phentylamine, their role begins, imidazoline's class, they dance and sing, pheochromocytomer's foe, their victory wing. A1 antagonists, prostate's quiet friend, trazocin, prazosin, on them we depend, BPH's calm, in their grasp we mend, but a disconnect exists, a puzzle to comprehend. Quinazolinases, with vasodilation's art, dizziness and hypertension, a side effect's part, yet in structures unique, their potency chart, once daily dosing, a convenience to impart. Beta blockers rise, in hypertension's fight, propranolol's history, a beacon of light, B1 and B2, in the receptor's might, cardio's elective dance, in arrhythmia's night. Timolol, atenolol, a pharmacopoeial chart, araloxapropanolamines, from propranolol's start, glaucoma's ally, hypertension's smart, Nobel laureates, in the science of the heart. Labetalol, carvedilol, a dance of blend, A1, B1, B2, their effects transcend, alpha receptor affinity, they mend, antihypertensive dance, a message to send. Metiozine, carbidopar, a tale of modulate, adrenergic transmission, they regulate, hypertensive episodes, they abate, in the dance of enzymes, their fate. Guanethidine, guanidril, in norepinephrine's hold, antihypertensive past, a story told, cocaine's prolong, a synaptic gold, tricyclic amine, in reuptake's fold. amitriptyline, docipin, and imipramine's might, tricyclic antidepressants, in serotonin's flight, promiscuous antagonists, in receptors light, Mao and Kant, in Parkinson's fight. In the sonnet of drugs, a symphony grand, adrenergic knowledge, a scholar's command, pharmacist student, in wisdom's hand, a dance with molecules, in academia's land. Sonnet on anti-seizure agents for pharmacy students. Pharmaceutical chemistry we traverse. The 26th of October, 2023, Dr. Simon Wang, diverse. In room #310, CCH our guide, office hours on Thursdays, knowledge to confide. Selective CNS drugs, depressants their name, for epilepsy's grip, they play the game. Syndromes affect, 1% in sway, anticonvulsants aim to light the way. Pathological neurons, their target grand, prevent seizures excessive, spreading, unplanned. Not altering the underlying ill, but calming foci, neurons' restless thrill. Idiopathic, no visible strife, yet neurons misfire, disrupting life. Anti-seizure agents, a myriad, their noble cause, seizures to forbid. 2 million Americans in epilepsy's care, 40 types wear a medic alert glare. 80% tamed, but 500k uncontrolled, prophylaxis and cure, yet dreams unfold. Compliance, a challenge, side effects vast, long-term use, a journey so vast. Physiological mechanisms unfold, and channels, GABA's embrace told. Seizures transient, neurons wild dance, epilepsy's grip, unpredictable chance. Partial seizures, cortex bears the weight, visualized by MI, destiny's gate. Animal models, chemical-induced fray, pentylnetetrazole, seizures in display. Maximal electroshock, kindling's embrace, inhibitors indicative, partials grace. MES seizures, absence, and SCMET2, their drugs, a palette of varied hue. GABA, Na plus, CA and plus, the channels in play, pathophysiology, seizures at bay. Increased excitatory amino acids reign, transmission spikes, a neuronal gain. GABA's decline, the seizures unfold, unstable membranes, a story untold. Stabilize and prevent, the strategies laid, ion channels, GABA, EAA conveyed. Classifications abound, actions precise, phenytoin, carbamazepine, valproic's device. Phenytoin, the pioneer, and it restrains, lamorigine joins, in similar strains. Valproate broadens, affecting and GABA, gabapentin's mystery, GABA's enigma. Vigabatrin, inhibition's decree, topiramid's dance with GABA, a mystery. Tiagabine inhibits reuptake's flow, zonizomide, and or CA and to show. Carbamazepine, oxcarbazepin's kin, and channels blocked, their fight to win. Valproic acid, GABA's dear friend, taming seizures, until the end. Acetozolamide, diamoxa's call, carbonic anhydrase in seizures thrall. Magnesium sulfate, the guardian near, blocking transmissions, calming the fear. Lamorigine, valproic acid's peer, in grand mal and mixed, its presence clear. Tiagabine and topiramate, a duet, adjuncts in therapy, seizures debt. Felbamate, potent yet careful tread, gabapentin, mysterious paths to spread. Levetiracetam, Kepra's grace, primidone, mizoline, in seizures chase. Pharmacy students, the knowledge vast, anti-seizure agents, their shadows cast. In chemistry's realm, epilepsy's fight, guided by wisdom, in scholarly light. Local anesthetics in pharmaceutical realms where wisdom gleams. The 8th of November, in Dr. Wang's Hall of Dreams. The study deep, in chemistry's embrace, reveals local anesthetics' nuanced grace. Administered with precision skill, topically or through veins, they fulfill a realm of numbness, where they tightly cling, blocking nerve pathways, pain's cruel sting. Motor function fades, in their tranquil wake, on sodium channels. These drugs partake, binding with grace, a dance on membranes high, interfering, action potentials belie. Contrast with generals, broad in their might, affecting membranes with a fluid plight, local, specific. They quell the nerve's song, in history's tale, their journey is long. From cocoa leaves, a sedative trace, in 1860, Newman's wondrous grace, cocaine, a crystalline salt to behold, anesthesia's tale, through time unfolds. Procaine's dance, with vasoconstrictors bold, tetracaine and benzocaine, stories untold, isogramines serendipitous find, led to lidocaine, akin in kind. Ideal, the anesthetic we desire, reversible, swift, with no harmful fire, sufficient in time, devoid of systemic ill, a beacon of safety, the pharmacist's skill. Nerve membranes whisper, in electrophysic lore, sensory and motor fibers, intertwined at their core, resting potential, a delicate ballet, and permeates, while now and must stay away. Action potentials search, sodium channels play, briefly open, ions dance, a rhythmic display, thresholds, refractory periods, a dance of might, nerve cells, in symphony, conduct signals bright. Sodium channels, intricate in design, gatekeepers of signals, in neurons align. Diclonine, proparacaine, a pharmacologic hymn, in pharmaceutical preparations, they shimmer and dim. Creams, ointments, aqueous solutions in line, amids, more stable, in preparations fine, lipophilicity, a key to their might, epinephrine enhances, in anesthesia's light. Toxicity whispers, through ACEs keener, cardiac channels, ACE receptors near, neuromuscular junctions, a delicate space, CNS effects, in anesthetic grace. Chemical effects, in nerve cells profound, sodium ions hindered, their movement unwound. Defined SAR, a beacon to guide, blocking and channels, at concentrations high. Binding sites elusive, on sodium channels they dwell, tonic and phasic inhibition, a pharmacologic spell, physico-chemical dance, in nerve membranes bound, tertiary amines, ionized, their actions unbound. Amino esters, amids, ethers in flight, lipophilic warriors, in the nerve's twilight, 2,6-dimethyl, a key to their dance, lengthening chains, a potency trance. Hydrophilic portions, tertiary amines stand, stereochemistries whisper, in bindings grand, metabolism's waltz, in liver's grand hall, amino esters succumb, to cholinesterase call. Lidocaine's journey, in CYP1A2S might, CNS toxicity whispers, in the pharmacologic night, metabolites dance, in pathways unique, tocainide and tolokine, side by side they speak. Articaine's theophane, in nature's embrace, benzocaine, a topical grace, chlorprocaine's infiltration, brief but strong, in pharmaceutical symphony, they belong. Lidocaine, mapivocaine, ropivocaine's might, class IB antiarrhythmic, in pharmacologic light, bupivacaine, a racemic feat, levobupivacaine, in enantiomeric beat. In Dr. Wang's lecture, a sonnet's song, pharmacologic nuances, in verses strong, local anesthetics, a tale profound, in the symphony of drugs, their echoes resound. In the realm of rest, where calmness unfolds, pharmaceutical chemistry, truth be told. The 1st of November, 2023, in room 310 with Dr. Simon Wang, the knowledge wheel sync. Sedatives and hypnotics, the subject profound, CNS depressants, a tranquilizing sound. To quell restlessness, emotions run high. They induce sedation, a sleep-inducing sigh. Sought in emotion, tension chronic and near, hypertension, analgesics potent cheer. Control convulsions, anesthesia's aid, in this realm of calmness, where they're displayed. Insomnia's shadow, an insufficient rest, transient, short-term, or chronic, the unrest. Dosage dictates, sedation or sleep's embrace, a higher dose for hypnotic grace. In high doses, anesthesia's demand, depression's degree in the chosen strand. Adverse reactions, drowsiness to death's door, prolonged use, dependence ominous law. Bromides and alcohols, once widely sought, NuBr, KBr, and alcohols taught. Branching, halogens, a dance of effect, in the chemistry of calm, a profound connect. Chloral hydrate, a sedative trust, trichloroethanol, its hypnotic thrust. A gem dial's embrace, in chloroform's light, anesthesia's past, in chemistry's night. Barbiturates, a vast synthesized sea, long, intermediate, and short, as they be. Hypnotic activity, a dance of acid, lipid solubility, a pharmacologic ballad. Structure-activity relationships, a song so clear, lipophilic dance, hydrophilic cheer. Substitution, branching, unsaturations play, in the chemistry of calm, a structured ballet. Benzodiazepines, a new dawn's embrace, binding to Guevara, calming grace. Metabolism's dance, fluorazepam's tale, long-acting echoes, in chemistry's trail. Non-benzodiazepines, a modern hymn, zolpidem, zopiclone, and zaleplong's swim. Imidazopyridines, pyrazolopyrimidines song, in the chemistry of calm, they all belong. Rameltian, a melatonin's kiss, selective receptors, in the chemistry of bliss. Antidepressant hypnotics, a side effect's tale, in chemistry's embrace, a calming sail. OTC antihistamines, a drowsy tune, diphenhydramine, doxylamine's boon. Herbal whispers, valerian's dream, in the chemistry of calm, a natural stream. In the symphony of rest, where molecules play, sedatives and hypnotics, guide the way. A sonnet of chemistry, a structured delight, in the pharmacologic dance, a tranquil night. In the realm where drug names hold their reign, where general anesthetics dance with grace, pharmaceutical chemistry, the learned terrain, where the 2nd of November, 2023, marks time's embrace. Dr. Simon Wang, The Guide Through Halls, CCH, RM-310, the space where knowledge dwells, THR 11 AM to 1 PM, his office calls, to delve into the deep pharmacological wells. Anesthesia's loss, of senses or consciousness, in general's realm, where consciousness may fade, analgesic allies join, in a drug-filled caress, sedative, hypnotic, relaxant parade. Nitrous oxide, the pioneer's debut, in 1844, unconsciousness it drew. Ether followed, in 1846's ballet, toxic now, but once held sway. Chloroform, the 1847 star, cardiac toxicity its fall from par. Contemporary agents, halogenated kin, swiftly saturate, dance and spin. Analgesia, amnesia, euphoria blend, delirium's dance, excitement's trend. Surgical anesthesia, unconsciousness reigns, respiration regular, eye movement wanes. Respiratory paralysis, the final stage, medulla depression, a silent cage. Desired properties, rapid and pleasant, safe withdrawal, relaxations present. Pharmacokinetics meticulous walls, administered by skilled anesthetic salts. MAC, partition, metabolism's dance, factors considered, in anesthetic trance. MAC, the standard, in the lungs' embrace, agents reaching saturation, a swift race. Blood gas ratio, a desirable theme, solubility in blood, the anesthetic dream. Absolute stereochemistry, enantiomer's play, anesthetic activity, a mysterious ballet. Ion channels, receptors grand parade, lipid-protein interactions, the dance portrayed. Chloride ions, Gabara's domain, benzodiazepines and barbiturates sustain. Sodium channels, glutamate's embrace, inhibition by halothane, the delicate grace. Nicotinic receptors, sodium's gate, potassium channels, anesthesia's fate. G-protein dance, neurons call, morphine's waltz, GABA's fall. Halothane's entrance, in 1956's glow, blood gas coefficient, a number to show. Enflurane, a 1973 debut, isoflurane, improved safety's cue. Disflurane's arrival, in 92's scene, low partition, rapid induction's sheen. Sevoflurane's odor, non-irritating theme, methoxyflurane, a rare and risky dream. Metabolism's shadows, toxicity's embrace, rare exposures, a dangerous chase. Malignant hypothermia's fevered race, cooling, oxygen, dantrolin's grace. Intravenous dances, propofol's lead, GABAergic enhancement, a soybean seed. Ketamine's trance, an elephant's need, itimidate's short-lived, propylene feed. Thiopental's call, short-acting quest, induction's whisper, with others it's blessed. In this sonnet of drugs, their stories unfold, anesthetic ballet, in pharmacology's hold.
Grateful and humbled to be pursuing further studies as a pharmacist in training in the US. These episodes will be under the theme The Journey to Narcolepsy Success. These will cover, in summative form, key points that stand out to me as I embark on my journey as a pharmacy student and chart a course to narcolepsy success. Note the purpose of these episodes. These are not at all for advice or medical suggestions, but to provide support for pair pharmacists in training in educational and intellectually stimulating ways. These are not at all for medical advice or for medical suggestions. Please see your local state and board certified physician, PA, or NP, and pharmacist for medical advice and suggestions. The new chemist becomes a pharmacist in training, the journey to narcolepsy success. So the NARPLEX, the North American Pharmacist Licensure Examination, is a standard examination created by the National Association of Boards of Pharmacy, NABP, to help individual state boards of pharmacy assess an individual's competency and knowledge so that they may be given a license to practice. Some big abbreviations you want to keep in mind: USP, United States Pharmacopoeia 34, and Natural Formulary NF 29. So this will be episode 2A. So there will be a 2B and there will be a 2C. So this is 2A, episode 2A. So biopharmaceutics and drug delivery systems. So some key ideas we want to keep in mind. Biopharmaceutics is a study of the relation of the physical and chemical properties of a drug to its bioavailability, pharmacokinetics, and pharmacodynamics and toxicological effects. Key terms in review: your drug product. It is the finished dosage form, example tablet capsule solution, that contains the active drug ingredient in association with non-drug, usually inactive ingredients, excipients that make up the vehicle or formulation matrix. Drug delivery system is a more complete concept, which includes the drug formulation and the dynamic interaction among the drug, its formulation matrix, its container, and the patient. Bioavailability is a measurement of the rate and extent or amount of systemic absorption of the therapeutically active drug. Pharmacokinetics is the study of the body's effect on the drug, ADME. Pharmacodynamics is the study of the drug's effect on the body. So how we're going to do this episode is going to be completely lyrical. So we're going to begin the lyrical portion right now. Biopharmaceutics and drug delivery systems. Biopharmaceutics is like a Rubik's Cube, with your 4 ideas making you drool. Bioavailability is a measurement of the rate and extent or amount of systemic absorption. Please take the right portion. The systemic absorption of the therapeutically active drug. Yeah. Biopharmaceutics includes pharmacokinetics. Your A, your D, your M, your E. The effect of the body on the drug with that A absorption, D distribution, M metabolism, and excretion. Biopharmaceutics includes pharmacodynamics with the effects of the drug on the man. We are looking at the relation between drug concentration at the site of the action, its response, which is the main caption. Woo! Then we also consider in biopharmaceutics the toxicologic effects. Lest I forget, the drug product in its formulation matrix or vehicle with the active ingredient and excipients. Lest I forget, the drug delivery with the dynamic menagerie of interactions among the drug, its formulation matrix, its container, and the patient. Continuing on with the spiel, let's drive the drug transport and absorption wheel. Across the cell membrane, the drug molecules enter the bloodstream and are transported to the tissues and organs. Let's look at some key processes in absorption. Transcellular passive, diffusion and partitioning. Paracellular transport, diffusion and convection. Let me add some vocal inflections with your carrier mediated transport and the P glycoprotein mediated efflux, which we'll get to in episode 2b. These general principles are important, you see. These general principles are important to know. These general principles are important so assimilable. Compose P, passive diffusion. In thugs, they traverse the cell membrane easily than your ionic soluble drugs. We cannot forget the LMWs, the low molecular weight, just like the chemical thugs, across a cell membrane more easily than the high molecular weight drugs. Let's keep it going. Do you hear what I say? We will progress in pharmacy. HU, you know. Passive diffusion and partitioning within the cytoplasm, or the fluid that's interstitial. Your drugs under transport. This is not pontifical, it's simple. The simple diffusion with a great fixed law. Simple passive diffusion involves the transfer of drugs from an area of high concentration C1 to an area of low concentration C2. According to Fick's law, dq over dt equals ideally dA over H in brackets C1 minus C2, where dq over dt is the rate of drug diffusion. You see, D is the diffusion coefficient for the drug. A is the surface area of the plane across which transfer occurs. Remember your chemistry thugs. H is the thickness of the region through which diffusion occurs, and C1 minus C2 is the difference between the drug concentration in area 1 and area 2 respectively. So with the passive drug transport, welcome to my conceptual court. It involves successive partitioning of a solute between aqueous and lipid phases, as well as diffusion within respective phases. Modifying Fick's law, please. Let's applaud. I'm kidding, but we do this to accommodate partitioning of drug. dq over dt equals d times a times k over h in brackets C1 minus C2, where hold it, the rate of drug diffusion dq over dt now reflects its dependence on K, the oil to water partition coefficient of the drug, as well as on A, and in brackets C1 minus C2. Rum pa tum tum. Ionization of a weak electrolyte. You know, I always wanted to be an acolyte, a thurifer, a catechist, or a trumpeter, you see, but today we're talking about my good friend, not the trumpeter, but le chatelier, in the ionization. So ionization is affected by pH of the medium in which the drug is dissolved, as well as by the pKa. Remember, non-ionized are like the chemical thugs, more lipid soluble, the diffusive plug, if you will. They are more lipid soluble than the ionized, and it partitions more readily. Hopefully by now you realize. Rumpa tum tum, let's have a drum roll. Here, little beggar boy. Oh, that's 4. The periodic table. Let's talk about the transport process that's not a fable. The active transport of the drug with it moving across a concentration gradient, requiring energy, selective potentially, saturation possibility, and competitive it can be. Yet we must look across the hall and see that facilitated diffusion is on the carrier-mediated transport system walls. Facilitated diffusion occurs across a concentration gradient and does not require energy. Obrigada, e você? Como você está? Tudo bem? Tudo bem? Tudo. Wow, fala pequeno português. So let's talk in English, por favor. S'il vous plaît. With that paracellular transport, drug transport across tight, narrow junctions between cells or trans-endothelial channels. No, I'm not talking about fire stick, but let me give you a conceptual trick. Paracellular transport involves both diffusion and convective or bulk flow of water and the accompanying water-soluble drugs to the channels. That can be a hint. Now let's look at the vesicles, newly minted idea in this lyrical scheme. Vesicular transport is the process of engulfing particles or dissolved materials by a cell. Engulfment. Pinot, we're drinking. Phago, we're eating. Pinocytosis, engulfment of small solute or fluid volumes. Phagocytosis is the engulfment of larger particles, your macromolecules, generally by macrophages. Endocytosis and exocytosis are the movement of macromolecules into and out of the cell. Biopharmaceutics and drug delivery systems. So we've reached the end of this lyrical scheme. You see, but we'll pick back up conceptually in episode 2B. Okay, so grateful and humbled to be pursuing further studies as a pharmacist in the US. These episodes again will be under the theme, The Journey to NAPLEX Success. These will cover in summative form key points that stand out to me as I embark on my journey as a pharmacy student and chart a course to NAPLEX Success. Note, the purpose of these episodes not at all for advice or medical suggestions, but to provide support for peer pharmacists in training in educational and intellectually stimulating ways. Not at all for medical advice or medical suggestions. Please see your local state and board certified physician, PA or NP, and pharmacist for medical advice and suggestions. The newcomer becomes a pharmacist in training, the journey to NAPLEX success. The North American Pharmacist Licensure Examination, NAPLEX, is a standard examination created by the National Association of Boards of Pharmacy, NABP, to help individual state boards of pharmacy assess an individual's competency and knowledge so that they may be given a license to practice. So this is an important exam. So big abbreviations you want to keep in mind as we conclude: USP 34, United States Pharmacopoeia 34, and NF Natural Formulary 29. So this is the end of the episode. Thanks for listening.
Thanks for listening to the podcast series The New Student Pharmacist, where we discuss chemistry and pharmacy, as well as leaders in pharmacy careers, community, and chemistry and pharmacy research. We encourage you to support the work we are doing and follow us on Spotify and Apple Podcasts by subscribing for free. We are so glad that you were able to tune in today. Note: the views on the podcast represent those of my guest, and I take care and all the best.